And then we saw in September as well that they launched the America First Global Health Strategy,
Right.
Which I know you've talked about how it focuses on pandemics and data and doesn't even mention the word women in the strategy. Does not.
That's shocking.
Extraordinary.
Yeah.
It is shocking.
A year after USAID was dismantled and U.S. foreign assistance was suspended, where do things stand? How has global development, global health, and sexual and reproductive health and rights fared since then? Well, Beth Schlachter of MSI Reproductive Choices, who is an expert in U.S. foreign policy and a former diplomat, joins us today to explain to us what's going on. Hello and welcome to the famous podcast. Today I'm very pleased to have with me Beth Schlachter, who is the Senior Director of U.S. External Relations at MSI Reproductive Choices. She's based in D.C. and we're going to talk about what's happening with U.S. foreign assistance more than a year after DOGE destroyed USAID and the U.S. Foreign assistance budget was frozen. Welcome, Beth.
Thank you, Françoise. It's a pleasure to be here, even if we're talking about a very disturbing topic.
That's right. Let me introduce you a little bit more fully. You are the Senior Director of U.S. External Relations at MSI Reproductive Choices, based in D.C. You've had an illustrious 13-year career at the State Department, where you were a senior diplomat. And in particular, you were a lead negotiator for the U.S. government on issues of population, including sexual and reproductive health and rights. You were also previously the executive director of Family Planning 2030, the global partnership to advance reproductive rights through improved access to modern contraception in the global South. So you know this topic inside and out. And I want to say to our listeners and viewers that you and I go back many years when we worked on UN negotiations together, you on the U.S. government side and me at the International Women's Health Coalition. And you were always as much of an ally and as creative as possible to advance sexual and reproductive health and rights as was possible given the constraints that diplomats face. So you are someone who, we trusted in these negotiations. Welcome. And I want to say you were my first podcast guest a year ago, a little more than a year ago. You were the first episode. So it's fitting that a little more than a year later, we meet up again to discuss what's been going on. So last year, when we spoke barely 3 weeks after Donald Trump had been sworn in. And we were already witnessing chaos and carnage in U.S. foreign assistance. It was fast. USAID was being dismantled by Elon Musk and his DOGE. The entire budget, the $40 billion in foreign assistance, was frozen, and there was already talk that it would be cut entirely. And the Global Gag Rule 2.0, the one focused on abortion, had been reinstated to block future work on abortion by recipients of U.S. foreign assistance. So at the time, I remember we were quite shocked by the dismantling of USAID, which came as a total surprise to you and to me and to everybody else. And you told me that you didn't feel the administration really knew what it wanted to do, what its priorities were. It was really unclear. Do we have more clarity now, more than a year later? What does U.S. foreign assistance look like at this point?
It's a great question, and thank you for the warm welcome, Françoise. It's a pleasure and an honor to be here with you. I feel like our careers have sort of moved through this transition in time that our sector has been buffeted through in fascinating ways. Global culture around women, around sex, around sexuality. It's all played out in one way in the platforms where we live and work. And so it's been fascinating to be on this ride with you, and the trust goes both ways. So thank you very much for having me. But when it comes to the Trump administration, I think we do have a lot more clarity in terms of how they want to use U.S. foreign assistance. It's very clear at this point that the Trump administration is transactional, and they actually mean what they say about whatever they determine to be in America's best interest. And there's a lot of question about whether that determination is anywhere near reality.
Mm-hmm.
That is going to be the driver of how they push things forward. And they have a coalition government, and some people within that government care very much about tearing down what we consider to be the global normative framework and processes around SRHR and development overall. Sometimes they're leading with the destruction on SRHR. Sometimes they have broader objectives and they're using SRHR because it's a convenient tool or a wedge process for them. It's hard to know on any given day. Is it the people who want to destroy SRHR and access to abortion and access to contraception and to really hinder women's autonomy and empowerment? If they're the ones who are driving something, if there are other objectives that are in play, which we've seen with these sort of funding mechanisms that have come in to play recently, where they're negotiating reinvestment through sort of a PEPFAR and pandemic control lens, but they're tying investment for health to mineral extractions and other things that the U.S. government might want or agreements they might want from any particular country. It's a very explicit process of, we will invest in you, but there's going to be a cost. Right. And you're going to sign on the line, and we're going to be very clear about what this agreement is. Right. So we've seen a complete transition of U.S. foreign policy and the framework from which we have worked on development for decades as a global community.
Right, and it's so, in a way, it's basically those two main blocks of the modern Republican Party, which is the cultural religious ideologues, the Christian nationalists with their anti-abortion, anti-gender crusades, and then the business interests, right, who want access to African minerals and resources. And so they've merged the two, basically. That's what you're saying, that they're signing agreements now with a lot of African nations to say, if you want to get global health funding on issues of very discrete issues of health, but you'll need to give us access to your data and your minerals and other resources, right? That's what we're looking at. Wow. And
that is the deal.
Yeah, we didn't expect that a year ago, I have to say. That was
no. And they rolled out these processes and policies over the course of 2026 until they sort of got to the end of the year when the merging of these two became very clear. So even last year when they thank you, 2025. Took me a second there.
Yeah, things are going too fast.
We saw that exactly. What year is this? It all feels like a massive time warp. But with the freezing of foreign assistance and then the restarting of it, the one area within global health that we saw that received any kind of favorism or any preservation of investment was through the PEPFAR programs. Not to say it wasn't damaged, not to say there wasn't a lot of scattershot collateral, and particularly for pregnant women or women hoping not to transmit HIV. There was a real frontline damage to that, and when we saw that very clearly. But they pretty quickly came online as well to have bridge agreements through last year that got us to the end of the year. So I want to talk about that in a minute, because other things also happened. Our community's been pretty focused on these funding agreements, but we want to look at the overall framework in terms of how they're looking to damage this as well, because a really important and insidious thing happened last year as well around the Human Rights Report. I'm not sure that everybody knows that for many decades now, the U.S. has undergone a process of publishing an annual human rights report. And the way that they gather information for that is they send out a message every year to all of the U.S. embassies around the world, and they ask that embassy to gather information and report back on a series of questions or areas where they see human rights infractions or that there's potential for human rights infractions, and they just really want to track progress. So under the Obama administration, we were able to put in a lot more language around maternal health as a human rights priority, on countering sexual violence, and to push in a lot of the areas around reproductive rights as part of the human rights framework so that
Right.
embassies would report on that. Of course, the Trump one took that down, Biden put it back in, Trump took it out again. But this year, when they sent out guidance, they asked embassies for the first time to report on abortion. And interestingly, the way that they framed the questions that went to the embassy were the first area was on right to life. And the first question they asked under right to life, which was hugely ironic at the time, was around extrajudicial killing. And this was the very same week that we were blowing up boats in the Caribbean without knowing who was on these boats,
Wow.
being able to verify that. So we were actively committing a human rights violation around extrajudicial killing.
Right.
But then the second question they asked about was abortion. And abortion had never been included in the human rights report before. And they asked for countries to be able to report back on the numbers of abortions in countries and government support for abortion and the policies therein. So they're unlikely to be able to gather a lot of data around numbers of abortions because we know that those numbers are not really stable at this point. The measurement frameworks around that are a little tricky.
Yeah.
But by putting that question in there and having the embassy go to the government to say, hey, we want to know for our human rights report how many abortions you're doing or you're supporting in your country, that's a new level of stigma and an implication around abortion as a human rights violation that we haven't seen
Right.
before. So
Right.
we're still waiting for the report itself to come out at some point this spring. So we'll see what they have to say about that. But that's a massive shift, right, in their sort of effort to try to stigmatize abortion further.
Mm-hmm. Mm-hmm.
So that's one area. And then we saw in September as well that they launched the America First Global Health Strategy,
Right.
which I know you've talked about how it focuses on pandemics and data and doesn't even mention the word women in the strategy, does not.
Extraordinary. That's shocking.
Extraordinary.
Yeah.
It is shocking.
Shocking.
Does not. It's like, yeah, quite can't quite get my head around that one. And doesn't include contraception or family planning. And then we saw that in the framework as well for these funded agreements that they started negotiating in November to bring PEPFAR back in as a sort of global health priority, along with TB, malaria, and a bit of maternal health, but we haven't really seen any details emerge on that yet.
Yeah. And
So we can
PEPFAR,
go more on MOUs.
who don't know, PEPFAR was the president's emergency plan for HIV/AIDS,
Right.
which was started under George W. Bush. So it had always had Republican support, in fact, quite a lot of support. And so they had suspended that last year, but now they're trying to revive it specifically to, again, promote very, very narrow interests in the global south with respect to certain
Right. They
diseases.
never fully suspended it.
Yeah,
They
no, yeah,
the funding was up and down, but
yeah,
the program wasn't ever fully suspended.
suspended. Okay, right.
Close enough.
Close in, yeah. So, I mean, if you look at the entire development sector, this has been a massive shock to the system, right? A moment of reckoning, I
Absolutely.
suppose, because also at the same time, other countries have also pulled back with their development assistance for other reasons. I don't know if it's is because they felt authorized given what the US was doing, or they have their own austerity, plans, a lot of conservative talk. So the UK, Sweden, the Netherlands are also, they have right-wing governments in some cases, like Sweden, and they're pulling back. So that's, what are you seeing on the ground with MSI Reproductive Choices in terms of the impact of all this turmoil in development funding?
I think you can look at it in a couple different ways. First, in terms of the funding for reproductive health systems, for the systems themselves,
Yeah.
um, and uh, and also for the sort of self imposing of global gag rule restrictions, the obeying in advance, even before you know what the limits are and what's even being asked of your country and government. So start with funding. Of course, that was really catastrophic. The U.S. cut 54% of its ODA in 2025, over $38 billion, with significant loss to the SRHR sector overall. The family planning contracts were all just frozen, stopped, cut off. Interestingly, I know you asked me about countries, but I just want to get this point in too. Congress this last month appropriated another $607 million for family planning, just as it has done over the last 16 years. So Congress expressed an intention for the Trump administration to spend that money
Yeah.
on family planning, but the Trump administration so far has declined to give any indication that they intend to do so.
Hmm.
Congress doesn't seem to imply that they were going to assert their authority to insist that that the Trump administration spend this money. But there's a possibility that it could come through. It could come through from direct bilateral assistance for commodity procurement or system support or whatever it is that they might want to spend money on. But there is money there. It's just
Yeah.
they are not spending it. So when you get to the country programs itself, MSI colleagues share that they spent a lot of time last year just finding commodities anywhere they could, because you know how supply chains work. There might be more implants in one district and more condoms in another. Warehouses have things that are in sort of a pipeline all across. So they spent a lot of last year sort of pulling in those resources across the country to use them and rationalize what was where. If there's a shortfall here, let's pull it from this other place. Let's not wait for the supply chain to fill that. Excuse me. So we have some of the gaps that we expected weren't seen right away because
Mhm.
of those really heroic efforts in countries to put resources where they were needed or where there were shortfalls. But that is over. Everything that was available in the system has been squeezed out of the system. So the shortfalls are real. We're seeing countries that are considering shifting from um, things like implants or injectables, which have a higher front end cost,
Right.
but a longer return on that investment because of their reliability and the long time for which they work. We're seeing a shift to things like IUDs. So the concept of choice itself is going to be one of the first things, or has already been one of the first things to go by the wayside, because women won't have the opportunity to choose across those methods.
Right.
And this isn't just a short term impact, because the system will adjust to that and maybe will train less on implants or IUDs or injectables. They'll lose capacity if you don't do that routinely as
Right.
a part of your services. So even eventually, if those things become more available, the system is going to have to be retrained. People are going to have to get comfortable with it again. So we're seeing that kind of an imbalance happen. We're also seeing a lot of the impact of many grassroots advocates, because that, of course, is always the most vulnerable funding. And without those folks on the ground who have an ability to make a living as an SRHR activist or advocate, then we lose that connection of accountability
Hmm.
within systems to governments. And so MSI was able we actually did more services last year than any year before. Some of that are because of efficiencies in our system and because we focus on public system strengthening. So some of those numbers are captured within that as well. And also because there were fewer service providers. And so probably clients came to us as um, more frequently as well. We're still doing a lot of analysis on that. So I
Figure
don't want to
out.
speak too emphatically on that. Yeah. But it was our biggest year ever. We lost $14 million in US funding. We were able to make that up from within our own resources. And of course, it hit the outreach teams most of all. So we had to cut back on some of those.
Yeah.
And now our outreach teams are facing contingency planning is around oil shortages.
Oh,
If
yeah.
they're not able to access fuel to drive out to rural communities, they're thinking about plans for doing so on horseback or using, mules and other things that would be so.
Wow.
So we're going to see impacts in different ways. Yeah, it's
Yeah.
again, that's still at the planning stage of, if we have to, what will we do if we can't access fuel? But there's already fuel shortages, and the cost of it is now an unbudgeted um, uh, expenditure
Right.
that
Right.
people are going to have to figure out.
Yeah, I mean, last year we were talking about your teams in Zimbabwe who go to these
Yeah,
remote communities with reproductive health services, contraceptives, and other, testing and other things. And those were the only health services that these communities saw. Yeah. Every so
that's
many
right.
months, right? So once that's
Right.
not available, then those communities just are cut off, right? It's dramatic.
They're cut off. And for women, a lot of the trust comes from peer to peer. If your neighbor uses a contraceptive and has a good experience with it, then she's more likely to consider that method as well. But if you go to a clinic or you expect them to arrive on a particular day and they don't show up, or they show up with fewer commodities, different kinds of contraceptive methods, then that breaks trust with women, and it's very difficult to get that back.
Right.
So the costs are sometimes hard to measure because they're more in the soft things around the process of providing contraception. But we will be tracking all of that and sharing that with you as the real numbers and impact are measurable, and we can share more on that as well.
Right. I mean, I've been talking to different providers in different parts of sub-Saharan Africa, and they, of course, are very concerned about the loss of health workers, right? Because the funding for nurses, nurses assistants, community health workers, all the people who really fan out into the communities and are there in the markets, meeting people where they're at and so on. It just evaporated with so much U.S. funding being frozen or canceled altogether. So that's not, as you say, the repercussions will manifest over the next few months. We'll know better what this means, but it obviously is not good. there's no silver lining. Yeah.
No, there is no silver lining, and we're very concerned as well about. We're not yet clear because they haven't provided this clarity about how this global gag 3.0 might be attached to the bilateral assistance that's being clarified now through these MOU processes. So the MOUs themselves were an outline of an agreement for reinvestment. And then when countries signed on to those, most of the signing on was November, December, January. Then they entered into a bilateral 90-day period of clarifying what the project agreement was. And then presumably at the end of this 90 days, which should be now, they will actually have signed funding agreements. And it's at that point that we expect to see if the Trump administration will decide to apply global gag restrictions on that funding. And if so, will it be the full breadth of the 3 rules that they published in February, or will it be some aspect of those? They've said that there is a waiver process available, but they said it would be a very strict waiver process. So we have to see if they will apply that or not. Again, just a point of clarification, when the global gag rules were published, it said clearly that they must apply these rules to all multilateral assistance and to NGO assistance.
Right.
But it said that they may apply it to countries. So we haven't seen yet if they will do so and if they'll do so in every country.
Right.
And again, one of the unanswered questions is that the intent of these MOUs is that the money will be it will be a co-financing approach. So the government must put their money in the pot first, and then the U.S. will provide its money. But we don't know if all that money will be gagged or if only the U.S. money will be.
Right.
And that remains important because PEPFAR actually pays the salaries of enormous percentages of health workers in many countries. In Uganda, they pay the salary of over 95% of community health workers.
Wow.
All community health workers in Uganda.
Wow.
Those are the very people that you're talking about that work in rural clinics, that work in urban clinics. And so if they are constrained from working with organizations like MSI, where we are a big part of the public sector strengthening, then the government is either going to have to set up a parallel system or make decisions around who they can or can't work with. And other governments are also having contracts or agreements with those governments to do other work, including abortion. So how is a government going to decide how it applies its U.S. assistance and how it sets up these firewalls between what the U.S. pays for and what they pay for with their own money and what other governments are paying for? It's going to be enormously complicated, particularly when you break it down at the supply chain level, at the data level, and at that service delivery level. It's just a big mess.
It's a mess. And also injects so much complexity into systems that are already weak and not necessary. They don't need this kind of headache, right?
They don't need this.
No. And I mean, one of the the issues with the global gag rule 3.0, and I was talking to Jamie Vernalde of IPAS last month about the new expanded global gag rule, is that it goes after diversity, equity, and inclusion as well as gender ideology, broadly understood. So that would mean if they inject that into these bilateral agreements, which are going to be the future of our foreign assistance, I gather, that would mean that these governments would have to try to discern what gender work they can and cannot do, and possibly stop working on anything that promotes women's rights. I mean, at some point, where are we drawing the line?
Presumably.
Yeah. So that's crazy.
Yeah.
It's not just LGBT, which is already problematic enough, but gender is a much bigger category.
We've, the service delivery organizations are, of course, talking to one another, trying to figure this out together, because some of the U.S.-based organizations have, they're really reliant on U.S. funding, so they're trying to figure out if they should continue to take it and what it would mean to actually implement these rules. And we're of course trying to work on that together to help one another, because it's a very difficult moral decision, isn't it, about do you keep services going that are constrained within these rules because that is the greater good, or does the imposition of these rules make that money so tainted that it's causing more harm than good?
Right.
That's a very difficult decision to make, and not trying to put judgment on anybody who has to make that decision. MSI walked away, so we're in a different place with that, but there's that sort of Sophie's choice with that money. But even so, those are the organizations who've been in contact with the Trump administration to try to figure out how to implement and what their obligations are. And so far, my understanding is that the instruction that they've received is just, well, we published the rules, you figure it out. Like, we gave you enough information to.
Oh my goodness.
Which they emphatically have not. And so organizations are trying to figure out how to get actual clarification on what's legal and what's not legal. Mm-hmm. So that creates such a cloud of confusion that we know from past global gag rules that funded entities will over implement. They won't try to go up to the allowability and legality.
Right.
They'll come way behind that. So if they can't get clarification, that might happen. And if that's their attitude and approach toward governments, then that's going to be hugely problematic, because governments have no experience dealing with the global gag rule. This is brand new.
That's right.
And so we just see a lot of potential for over implementation. And in fact, we heard in Zimbabwe, it wasn't an MSI clinic, but from another partner, that nurses were already removing family planning posters from the walls because they were worried that that was going to have an impact, although ultimately Zimbabwe walked away from the MOU process. But you can see that people immediately start to not want to be the person who makes things, who causes a violation or gets anybody in trouble.
Right. I mean, that chilling effect is just, we've observed it with abortion in the global gag rule 1.0, 2.0 process, where nonprofits, foreign NGOs had to figure out how to not be seen working on abortion in any way, shape, or form, and not be seen in a meeting with other groups that were working on abortion, and and that was very difficult and very problematic, because of course abortion is an integral part of obstetric care. But now we're looking at diversity, equity, and inclusion, which could include racial justice issues, disability. I mean, anything that deals with marginalized and discriminated populations, as well as all of gender. I mean, we're not going to have programs dealing with girls anymore in schools? Like, what are we talking about?
Yeah, how do you deal with sexual violence? My understanding is they've said that where there's data to back up working with a key population, for example, we might refer to that key population as men who have sex with men, or working with LGBTQI communities. It might be a question of relabeling what you call that community, because the data backs up working with a certain set of of humans who need care.
Right.
So there may be some jujitsu available within those frameworks, but the fact that you would even have to do that when you have, a couple decades of evidence about why these approaches are essential,
Yeah.
and the stigma that gets applied to a process of having to rename something in order to be able to continue work that has so much evidence behind it
That's
for why
right.
it's essential is it's just hugely problematic.
Yeah, mind-boggling. And now this
Yeah,
new global gag rule 3.0 targets also the UN, multilateral agencies,
correct.
and that's going to have also a huge impact on the ground, I would assume. I mean, in places where MSI Reproductive Choices is working. How are you thinking about that? What are the repercussions
So
you're
many questions.
worried about?
Well, first of all, it's kind of ironic that because the U.S. decided early on not to fund UNFPA,
Yeah,
UNFPA themselves are sort of exempt from the global gag rule. So it'll be interesting to see how that plays out
right.
as other multilaterals start to get their funding. Because remember, the global gag rule only comes into force on the next funding agreement. So the U.S. would either have to rewrite its existing funding agreements to the extent that any continue to exist with multilaterals in order to include global gag rule language
In those
or to
agreements.
attach it
Mm,
to that entity.
mm,
Correct. We're seeing that play out now with the Global Fund and with OCHA. And so far, humanitarian money, the $2 billion that the U.S. announced in December, they also said they would not attach the global gag rule to that $2 billion. Let's see if that holds and if that plays out and what it means. And I think there were some conversations about that this week.
mm.
But we're seeing a lot of a more tenuous sort of response from the Global Fund. There are people who are really expert on that. That's not me.
Right.
But my understanding is that the Global Fund is looking for ways that it can sort of quietly implement those restrictions, should they be attached, even though their governance stipulates that they, as an entity, are not allowed to take money because it's a pooled funded entity
That's
that
right.
has these kinds of restrictions that would be blended with other funding. So
Right. Right.
I,
Right.
I think we're at the beginning of seeing how that plays out. But that's an area where we're worried about things like, well, then who quietly doesn't get a sub grant from the Global Fund? Or,
Mm-hmm.
you know, there are ways of implementing things without being overt about it in terms of decision making on funding. So we'll see how that plays out. But otherwise, at the UN, there's of course a lot of concern over the potential merger of UNFPA and UN Women. What's behind that? Who's
Right.
driving it? Do
Yes.
we have the kind of strength of leadership that we need in order to preserve not just the mandate, but the intent of these organizations? UN leadership keeps saying that they are going to preserve the mandates of ICPD in Beijing. Um, we both know that once you put a resolution to the General Assembly, you kind of lose control of what happens with that resolution.
Yeah.
And how do you protect these mandates when you have these global forces that are at loggerheads over these things? There's a lot of concern around that. So let's see how the funding, the global gag rule restrictions play out. One other area that we are watching very closely is the UNFPA supplies program. USAID had provided 35% of the commodities to Africa before they collapsed last year, and there had been a lot of work over the last 15 years to align the UNFPA supplies program with USAID's procurement processes so that there was just a lot
Contraceptive
of visibility there about
supply.
thank you, who is paying for what contraceptive to go to which country, and what were the systems and processes around that as well. USAID paid for a lot of supply chain improvement,
Mm-hmm.
a procurement process improvement.
Mm-hmm.
But now UNFPA is the only game in town, which makes them even more important. And there are discussions about supply or procurement for the UN when it comes to health, all merging under UNICEF's procurement mechanism. Well, right now, UNFPA can continue to procure whatever it wants to procure,
Right. It's
but
not
if it's
subject to
merged under
conditions.
a gag system,
Right.
correct, then it could be subject to those conditions if it goes under UNFPA, which would put the UN's contraceptive procurement processes under those same restrictions.
Yeah.
So that's something to keep our eye on. We don't know what's going to happen with that yet, but that's a very vulnerable part of the system.
Mm. And in closing, what is MSI Reproductive Choices doing in terms of advocacy in DC or with the UN? I mean, what are your immediate priorities for advocacy at this point, given all this and a lot of moving pieces?
Yeah, we've been spending a lot of time just creating opportunities for country partners, for donors, for stakeholders to talk about all of this. There's a lot to learn and to accept that there's not going to be one clear answer one day in the future. It's a very complicated process that they have unleashed on all of us at multiple levels. And we're going to have to get used to the idea that we're going to understand it in a complex way over time. And the best way to do that is by talking to one another, sharing information in a generous way, and then asking those who have power to use their power. For example, we've been asking European governments, can they, at the country level, go to governments and ask them how they intend to implement potentially gagged resources while still hewing to the agreements that they have with their governments as well. And to be very supportive and generous in those conversations of sort of helping them through this process because they need that U.S. assistance. U.S. withdrawing funding the way it did last year, as you said, it's chaos and carnage. And so stepping back into a partnership with the U.S., it's going to take all of us to mitigate the harms of whatever is going to be attached there and trying to get European donors in particular to play a part in that to the extent that they can. They've been dampened because of that tariff fear. And I know you're also Canadian, so, all kudos to Canada for the bravery in calling that out.
Yeah.
But we need those who are also funding to play a protective role here as well. And so we've done a lot of work to try to raise that awareness, to give people the information to feel comfortable talking about these issues because of their complexity. And then we spend a lot of time with our country teams as well to help them to understand what this might mean and to further feed the conversations they're having at country level with other stakeholders and with governments. Right now, it feels like that information sharing moment to have the strongest possible response. And then we'll see what actually happens when we see funding agreements and we know what it is that's going to be constrained.
Yeah. And I think you're absolutely right. The European governments can be encouraged to be more creative, more open. Sometimes they would be reluctant to raise these issues with governments in the global south and sub-Saharan Africa to say, how are you dealing with your U.S. funding? Because, that's not our business. But now it's everybody's business. It is so massive in terms of the impact that the Europeans can help these governments figure out how to create a separate bank account or some kind of, way of shielding European funding from some of these conditionalities with creative accounting, etc. So that they can really help if they're willing to step forward and be more, bolder than they sometimes are. Yeah.
Right.
Yeah.
That's right. We have to use power where we have power.
Yeah.
And the last thing I'll say is there are an awful lot of us that are not subject to the global gag, that are on the outside of this. And I think that we have to embrace our power as well. And not just be seen. It used to be seen as you were sort of outside because USAID funding was so compelling. But I hope we get rid of that framework. And instead, we own the power that we had. You spoke to Jamie last month from IPAS, MSI, Guttmacher, IPPF, UNFPA. We, in many cases, WHO, we are the drivers of that normative framework. Women, none of us are funded, right? Instead of being co-opted by US frameworks, we have to embrace the power that we have collectively because it is enormous.
Right.
And I think that that's a mind shift. And your podcast, your writing is helping us with that, Francoise, because we need to flip the switch in our own brains. And instead of being so fascinated by the minutia of what the US is doing and letting them co-opt our creativity and our energy, we need to deal with that. But we need to work with countries and others to create a different reality that really marginalizes and boxes them in, because that's where we need to be right now. And so we're spending time to try to, and there are many partners who feel the same, right? And we just need to own that power to the extent that we can.
Thank you for that. I can stand by that for sure. Well,
Great.
Thanks for your insight, Beth, and thanks for your amazing, brave work, your continued advocacy and brilliance. It's much needed in this troubled time. And a luta continua.
La luta continua. Thank you.
Bye.
Proud to be in this with you. Bye.
Bye.